Another show at another time.
Yes, it is.
Darren Andrews is here, the clinical director and a patient at PI Medical Group. And Gunner's here from Q95. You've heard him on a Bob and Tom show. You heard him on Flagrant Foul, Stuck and Gunner, Deep Cuts, Stairway to... Who else works there besides...
Just me, day and night.
You're going to leave here and go, like, seal coat the parking lot?
I live in the basement. I mow the lawn.
Okay.
Yeah, I do it all.
All right. So you've been on before. What made you decide that something needed to be done? It's like, dude, it's radio. You got all the free baseball hats you could have.
Well, first of all, I watch you on TV too much, so I see this beautiful hair that he has.
Want to bet?
You can see I have a little bit of challenge here. I've been doing laser therapy, and I decided I wanted more hair. So I talked to Darren about that.
Okay, so the laser therapy works better for some circumstances and not others?
Right, so Gunner initially was typical of a lot of guys that come in and don't want to go through the transplant right away. So the idea for a start with those types of guys is control the hair loss. So a couple of years ago he came in and said, look Darren, I want to control the hair loss. I said, great, laser hair therapy, did a good job of that. At the time he'd lost his hairline. He knew that laser therapy wasn't going to bring follicles back that were gone.
Right.
At some point we may have been talking about the hair transplant. Here we are today.
So the laser therapy is more maintaining what you have.
Correct.
Versus getting more.
And that's his before and after laser hair therapy. We took it, we reinforced it, we thickened it up a little bit. And, you know, that's held pretty well.
Sure.
And now it's just a case of Gunner wants to lower that hairline, and we're actually going to work through the top a little bit as well. And when you see the front on shot, you know, his hairline is pretty receded. And, you know, he wants to bring that down a little bit.
Go ahead and rub it in there.
Yeah.
But it's completely different when you realize that he's gone through it too.
Right.
So I mean, I think, do we have before and afters? We don't, of Darren? Okay.
I had mine done 11 years ago. So I've had one procedure. My hairline was still in place, but I was sitting pretty advanced behind it. So,
what all is involved?
So it's done at the pyramids on the north side here in Indy. So we do them all here. It's a 5-hour procedure. We do 2 types of transplants. We do artist robotic FUE and we do multi-unit hair grafting.
Do you understand any?
No, it's all Chinese to me.
So we're going to do the multi-unit hair grafting with him, which basically is going to give him the coverage he needs in one transplant. We're going to combine it with plasma. So we're using his own plasma from his blood, combine that with the transplant, gives him faster recovery. And we're going to bring the hairline down. One of the key parts with a hair transplant is the hairline. That's what people see. So the artistic requirements with the hairline are very important. And some of the pictures we'll see here shortly will give you examples of that, of how we use someone's facial measurements to tell us where the hairline should go. So you have an age-specific hairline no matter how old you are.
Oh, wow. I think we do have some examples of some other patients who've been there. There we go.
Yeah, so, with Jonathan here, again, we just brought the hairline down. He'd lost that sort of whole frontal area, had that classic little island in the front, just reframed his face.
Oh, I didn't know there was a name for it. Classic little island.
Yep.
I called it the Letterman. I thought it was...
It's a very, very technical term.
Sure, yeah. Well, I know exactly what you're talking about.
Same in this scenario. Another, again, frontal look. So you see the difference a hairline makes. And all these guys have had hairlines that have been developed based on their facial structure and how they're going to look as they age, because it's, you know, you change from a facial structure point of view as you age. So we design the hairline accordingly.
Gunnar, are you excited about it?
I'm very excited about it.
Wow, that is...
My wife is excited about it, which is great.
Yeah.
But, you know, we all have egos, and we all want to look our best.
Right.
So, yeah, I'm thrilled.
And we do crowns as well. So there's an example of a crown where we rebuild that swirl pattern in the middle and work out from there. So Gunner's going to do great. He's got great hair.
What is there for him to do? Because he's not the most disciplined individual in the world when he's not working.
Are you talking? I'm right here, Tracy. I'm sitting right here.
What are there responsibilities, maintenance issues after the fact?
But, you know, part of what we do is we stand behind our process very vigorously, and we actually guarantee our results right through 12 months post-transplant. So it's not just a case of coming in and doing the procedure. We step you through everything. The first few days, there's a little bit of light, sort of labor-intensive stuff from our point of view that we handle for the patient. She has a little bit for the first week or so. After that, once the transplanted hair initially goes through its initial healing phase, it's really just hurry up and wait. Takes 2 to 3 months, starts to grow.
I'm actually going to move in with Darren.
Well, he's going to be in my basement.
Yeah, I'm going to be in his basement.
In his basement?
My mom is finally...
I thought maybe you were going to go to the pyramids. Full disclosure, I visited with Darren, and it is a lovely office.
It is beautiful. I would live there.
Yeah, exactly. Yeah. Looking forward to seeing the results, which we know are going to be successful.
Oh, I can't wait. I'm going to be a beautiful man.
Yes, you are.
Thank you.
You're already beautiful.
Well,
quite handsome yourself. You're
very kind.
All right.
Thank you.
Amber?
Beautiful man he's going to be. Did you hear that?
Yeah. Well,
nice and beautiful.
Yes.
Already is. I know. I hear that radio voice.